Hi, I'm Dr. Mayank. I'm a board certified plastic surgeon and a diplomat of American Board of Hair Restoration Surgery, doing hair transplant surgeries in New Delhi for the past 12 years. Mostly when we decide to go in for a process of hair transplantation, the first question which arises is what exactly is the kind of technique or what we are going to do for the procedure, what is the number of the follicles and how is going to be my result. So when celebrities approach hair transplant clinics, there are many times that they don't permit us to share their images, but today we are going to share the story of one of the celebs who approached us by the name of Mr. Sandeep Mehta. He was about 55 years of age and was experiencing gross hair loss when he approached us. His major concern was that the roles which he was getting was relatively of aged people, and he wanted that there should be some youthful professional roles that he wished to do. Since he was a part of the TV industry as well as some movies, he was very specific about the kind of appearance that he wanted out of the procedure. So let's just have a look at what exactly we dealt with when he approached us. So he was almost at a grade 6, progressing to a grade 7 with only a 4-lock retention which was here onto the top in the form of a tuft. This density was also not adequate to give him a hairline or the illusion that it is relatively full. When we look from the top view, he had a huge crown area and the entire midsection was totally vacant, and the tuft you can see is hardly having any kind of density over here. Now came the major challenge. So his donor area in the back, when examined, was having extensive retrograde thinning right into his existing hair, apart from the crown dipping down into this format which is known as a coronet. So whatever hair follicles were here were suggestive that the crown is expanding further, the parietal humps were missing on both the sides, and this was an extensive grade of baldness which was very difficult to cover with the kind of expectations that he had. When we trimmed the donor area after the follioscopic analysis, we found that the donor density was relatively very less. It was hardly 65-68 follicular units a centimeter square, whereas the average density what usually people have is in between 80 to 90 follicular units per centimeter square. To add on along with that, he had a caliber of hair which was almost 60 to 65 microns. It was hardly, I would say it was like thin and silky hair what he had. So with this kind of the span of donor where the donor area has been restricted to hardly 4 to 5 centimeters, apart from the kind of donor density that he was having, the caliber of hair what he had was also hardly 60 to 65 microns. So to add on as a sum, if you look at the donor density, the caliber of the hair as well as the span, these were all challenges which were supposed to be handled or addressed to give him the kind of expectations that he was having. Since the hair caliber was very thin, straight, silky hair, so obviously body hair was not a very great choice to add on along with this, although his body hair distribution was also scanty, but some amount of beard was also utilized in the surgery to add on density onto the midsection. So when we decided what technique we would do for him, FUE alone was not going to give me more than 2200 odd grafts. We required at least a 3500 graft to give him a good frontal illusion so that it looked natural, it looked conservative as per his age, his face, but also served the purpose of him looking relatively younger to get the kind of roles that he wished to. This was the post-procedure implantation image. So if you can look, we have added on the whole of the frontal area, his 4-lock tuft, whatever gaps were there in between his existing hair, and added on a taper density into the midsection as well, so that from the front and the oblique view, his coverage would be complete. This was the kind of plan that we did decide preoperatively, and he was absolutely okay proceeding with the same plan. That was the left oblique view just after the implantation of the surgery. This was the top view, and this was post bandage opening. So we normally give a complete head bandage for about 48 hours. So post the opening of the bandage, you can see that there is barely any kind of swelling, but the density looks decent to give a coverage from the front view. This is the side view. You can see the FUT stitches right here with the trichophytic closure and the FUE punches that have been done. That's his look after 12 months. So when he came in again to us for a follow-up, he was extremely happy and his entire purpose of doing the transplant was completely solved. So this is the right oblique view. So you can see that I have just given him a front and a mid section coverage only. I have not covered the huge crown that he had, but still you can't see the kind of baldness that is behind this area for him after this transplant as well. Even from the left oblique view, if you look at this, the parting zone in this area, the entire parietal hump had been recreated so that he could comb it over and cover the entire area of the midsection as well. So what we learn out of this? We learn that hair transplant is not something that is uniform for every person. Whether you are a celebrity or you are a normal man, whatever you would want out of a procedure has to serve the kind of expectations, but those expectations need to be realistic in view of the kind of donor area that you have and the kind of recipient that we need to be covered. I hope it makes things clear to you, and if you have any further questions or concerns, please contact us on the numbers given below. I would like to thank each one of you of sparing time to view our videos and would request all of you to please like and subscribe to our channel if you find the content interesting and if you would like to see further such videos. Thank you.